Hi, this is Dr. Ahadian. I wanted to talk about an issue named shame. Basically, when we have traumatic effects happening to an individual in their lives in early childhood, which causes the individual to react in a way that is destructive, it causes a phenomenon that is called shame and guilt. For example, we have a child beginning with feeling very rejected, sent to be stealing, issues with regard to acting out, lying for the parents, to deal with problems related to severe lack of love, sense of rejection and abandonment that is being felt in young age. This child would have issues regarding conflicts with anger, rage, feelings of abandonment, and all of that causes another phenomenon called shame. Now, this shame causes problems with regard to poor self-esteem, demeaning attitude of oneself, comparing oneself to the object world, and demeaned way of looking at themselves, which could be called different type of names. One of them is shame. Now, I wanted to talk about how to deal with the issue with shame in this kind of situations. Actually, the shame could cause acting out, could cause obsessive behaviors, could cause drug addiction, could cause alcohol abuse, could cause a lot of difficulties in a relationship that one could go. Now, to help this condition, one of the most important ways to deal with that is therapy. Now, therapy, one aspect of the therapy is to have a therapeutic intervention, to have a relationship with someone who, this someone who's called therapist, would provide an environment of not abandoning, not demeaning, not criticizing, not being like the parent that the individual has had, not putting any kind of judgment on the parent of this individual. We have to look at it that this individual has not had a consistent parenthood, consistent parenting, was not consistently being brought up. So in therapy, we have a consistency that the person, the patient, feels consistent and cared for on an ongoing basis, on a long-term relationship, and that by itself causes positive expectations and positive experience, and by itself then begins to decrease the layer of the shame. Like shame could be like a layer of fat, a layer of dirt that it has to be cleaned up. Now, the consistency in a positive relationship is going to clean this dirt and then to metabolize this bad fat, as an example. The other way to deal with that is exercise. Exercising, not just going 5 miles a day for every day. We can set a goal, a program, like saying I would take 3 steps minimally, 3 times a week for the next 2 weeks. This is a contract we have with ourselves, and then if we come up with this contract, we achieve this goal, then the self-esteem is going to go up, we feel better, we feel confident, we feel achieving, we feel not rejected, not abandoned, we feel supported, and that's how we want to again get the fat down and then clean the dirt, which is the shame, slowly, and get rid of it. I'll talk to that extent again if need be, and any questions please refer to my email or my website. Thanks.